Okay, get this. Imagine, imagine going to the doctor and they prescribe you a treatment plan. But it's not just any plan. It's designed specifically for you by AI.
Oh, wow.
And that's not all. What if I told you that AI could even design completely new molecules for life-saving drugs? We're not talking science fiction here. We're talking about the incredible potential of generative AI in healthcare.
Yeah.
That's what we're diving into today using this blog post we found called Where Generative AI Meets Healthcare.
Hmm.
Ready to explore how AI could completely transform your health.
Absolutely. I think this is one of the most exciting areas in AI right now. We're not just talking about analyzing data anymore. We're talking about AI that can actually create new things.
Okay, so let's break this down. First things first, what exactly is generative AI?
Well, think of it like this. You give an AI a ton of data, right? Say, pictures of cats. And it learns from all those pictures to create brand new pictures of cats that look totally real.
Hmm.
Even though those cats in the picture, they never even existed before.
Wow. So it's like AI is becoming an artist.
In a way, yeah. And that same concept is being applied to healthcare, but in some really amazing ways.
Oh, I can imagine.
Definitely. Like one of the areas that's showing huge promise is personalized patient care. So imagine you have hypertension, high blood pressure,
Right.
and AI analyzes not just your medical history, which is what we do now, but also, get this, your genetic predisposition to certain medications, even your activity level, how much you exercise, how active you are.
Uh-huh.
It can even consider something like your access to healthy foods in your neighborhood.
Wow. So it's like taking like a truly holistic view of your health.
Exactly. Exactly. And then, based on all of that, it creates a treatment plan that is totally unique, tailored just to you, not just medication, but personalized diet recommendations, exercise routines, all based on like your actual lifestyle.
It's like having like a personal health advisor who just knows you inside and out.
Yeah, that's a great way to put it. It really is.
That's amazing. It's like AI is making your health plan fit your life instead of you having to fit your life around some generic plan.
Mm.
But how does it actually work? Where does it even begin?
Well, like with anything AI, it all starts with data. And
Hmm.
it needs a lot of it. Electronic health records, genomic data, information about your lifestyle, all of that.
I see.
The more data it has, the better it becomes at recognizing those patterns and making predictions.
So it's not just pulling from your medical chart. It's really considering all these other factors that could affect your health.
Yeah.
That's amazing. But, it also makes you think about how important data privacy and security are in all of this, right?
Oh, absolutely. That's crucial. Protecting patient data is paramount. And any system using AI in healthcare needs to have like really, really strong security measures in place.
Makes sense. Now, another area where we're seeing AI make waves is virtual health assistants.
Yeah.
Those AI-powered chatbots that can answer your health questions, schedule appointments, even offer support, like 24/7.
Right, right. Think about this. You live in a rural area, maybe miles from the nearest specialist.
Yeah.
You suddenly develop a cough that won't go away.
Oh, no.
Instead of waiting weeks for an appointment, you connect with a virtual assistant. It asks you about your symptoms, analyzes your answers, and if necessary, it connects you with a doctor for a virtual visit all on the same day.
That's amazing.
That's the kind of revolution in access we're talking about here.
Yeah. That could be life-changing for so many people, especially those who maybe don't have easy access to healthcare. But are these virtual assistants, are they just spitting out information, or can they actually like understand and respond to a person's individual needs?
That's a really good question. Ideally, they should be designed with emotional intelligence. They need to be able to understand the nuances of your concerns, give empathetic responses, and actually adjust their communication style depending on who you're talking to.
So it's more than just a robot. It's like having a friend who also happens to be super knowledgeable about health.
Yeah.
Okay. And speaking of knowledge, AI is also being used to analyze medical images like X-rays and MRIs.
Hmm.
And this has the potential to catch diseases much earlier than we ever could before.
Oh, absolutely. It's like having an extra set of highly trained eyes examining your scans.
Yeah.
Let's say you have an X-ray. And the AI system, trained on millions of images, flags a tiny little abnormality that a human radiologist might miss.
Oh, wow.
That could mean catching something like lung cancer at a very early stage when it's much more treatable.
That's mind-blowing. But does that mean, like, radiologists are going to be out of a job?
Not at all. It's not about replacing radiologists, it's about collaboration. The AI is a tool that can help them make faster and more accurate diagnoses. It's all about combining the power of AI with the expertise of human medical professionals.
So it's like having a second opinion from a really powerful computer.
Yeah, exactly.
This all sounds incredibly promising, but I'm sure there are challenges to consider as well, right?
Oh, of course. Yeah, definitely. I mean, there are always challenges with, bringing new technology into any field, especially one as complex as healthcare.
Right.
But, let's shift gears a bit and talk about another area where AI could really change the game, and that's drug discovery.
Oh, you mean like actually developing new medication?
Exactly.
Yeah, that whole process just seems like it takes forever.
Yeah. It can take years, even decades sometimes,
Right.
and it costs billions of dollars to bring a new drug to market.
Yeah.
But AI could really speed things up, potentially saving so many lives in the process.
Okay, I'm all ears.
Yeah.
Tell me, how can AI help with something like drug discovery?
So imagine this. Researchers are trying to develop a new antibiotic, right, to fight those drug-resistant bacteria that are becoming such a problem.
Yeah, scary stuff.
Instead of just randomly testing thousands and thousands of molecules in a lab, which is how it's traditionally been done, AI can analyze a massive database of all the existing antibiotics and how effective they've been against different types of bacteria.
Hmm.
And then, get this, it can actually design new molecules with specific properties, like, molecules that are better at targeting the resistant bacteria, or maybe have fewer side effects.
So it's less of a shot in the dark and more of a guided missile, so to speak.
That's a great analogy. And because AI can analyze data so much faster than humans, it can speed up that whole process significantly. We could see life-saving drugs reach patients a lot sooner.
That's incredible.
Yeah.
But can we really trust AI to, design medications that are both safe and effective?
Well, that's where the human element is still absolutely critical. Any new drug, no matter how it's designed, still has to go through rigorous testing, right?
Of course.
Preclinical trials with, cells and animal models, and then those extensive clinical trials with human volunteers.
Right, right. So AI isn't replacing scientists. It's more like giving them a powerful new tool to make the whole process more efficient and less costly.
Exactly.
What else can AI do in this area?
Yeah. Well, another really important application is predicting drug interactions. Like how your doctor might warn you about certain foods or medications you shouldn't take with a particular drug.
Right, right. Like how grapefruit can mess with some medication.
Exactly. AI can actually analyze these massive data sets of all the known drug interactions and predict potential problems,
Hmm.
which is really important for people who take multiple medications, which is becoming more and more common, especially as we age.
Yeah, that makes sense. So it's like having this safety net to make sure all your medications are playing nicely together.
Precisely. But, these predictions are only as good as the data they're based on, right?
Right.
So it's critical to have those comprehensive and up-to-date databases. And healthcare professionals, doctors, pharmacists, they all need to be involved in reviewing and interpreting the AI's findings.
It really seems like in all of these applications, it comes back to that partnership between AI and human expertise, using each other's strengths to get the best results.
Absolutely. Now, let's move beyond drug development for a minute and talk about how AI can advance medical research as a whole. One area that I find really exciting is creating synthetic data.
Synthetic data, what is
Okay.
that?
So think of it like this. Researchers need data to train these AI models, right?
Yeah.
But sometimes getting access to real patient data can be difficult because of privacy concerns, IP and all that.
Makes sense.
And that's where synthetic data comes in. It's artificial data created to mimic real patient data, but it doesn't contain any of that personal information.
Oh.
No names, no social security numbers, none of that. So it's like this virtual sandbox where researchers can play around and test things without risking anyone's privacy.
Oh, I like that, a virtual sandbox. So what can they do in this sandbox?
Well, they can train AI models, they can test out new algorithms, all without worrying about violating patient confidentiality.
That's pretty cool.
It's a really powerful tool, could really speed up a lot of medical research.
Yeah, I can see that. What other ways can AI be used in research?
Well, another way is by analyzing all of the medical literature that's out there.
Yeah.
Just imagine trying to keep up with all the new research papers, the clinical trials, the studies that are being published every single day. It's impossible.
It's overwhelming, yeah.
But AI can sift through millions of articles, right? It can identify trends, it can find connections, and it can even uncover things that human researchers might have missed.
So it's like having this super-powered research assistant that never sleeps.
Yeah.
It's constantly looking for those breakthroughs.
Yeah, Exactly. And this could lead to all sorts of amazing discoveries, from new diagnostic tools to completely new approaches to treating diseases, even a deeper understanding of how these diseases work in the first place.
Well, we've covered a lot of ground here. Personalized treatments, drug discovery, medical research. It feels like AI is going to touch every aspect of healthcare.
It really does. And while we've been talking about all the amazing possibilities, and there are many, it's important to remember that there are also challenges and considerations we need to be thinking about as this technology continues to develop.
Right, of course. Like with any powerful tool, there are always two sides to the coin,
Mhm.
especially in healthcare, where we're talking about people's lives. You're absolutely right. I mean, any technology this powerful, especially in healthcare, where people's lives are at stake, we have to think about those risks, right?
Exactly. And that's why I think it's so important to be having these discussions now while generative AI is still relatively early in its development.
Yeah.
We need to really think carefully about how we're implementing this technology to make sure that it benefits everyone.
Okay, so where do we even start? What are, like, the key challenges we need to address?
Well, I think one of the biggest concerns, as we've touched on already, is data privacy and security.
Right.
I mean, healthcare data is incredibly sensitive, right? You're
Uh,
talking about medical histories,
mm,
genetic information, really personal details that need to be protected.
Absolutely. And this blog post, it really emphasizes that point, talking about the need for those really strong security measures
Mm.
to prevent data breaches. And it also talks about the importance of being transparent with patients, making sure they understand how their data is being used and giving them control over it.
Right, exactly. It's not just about having those strong firewalls and all the technical stuff. It's also about building that trust with patients.
Yeah.
People need to feel confident that their information is being handled responsibly.
So it's this balance, right? Like using AI to improve healthcare, but also making sure we're respecting individual privacy.
Exactly. Now, another challenge we need to think about is making sure that these AI systems are fair and unbiased.
Oh, that's a great point. I mean, we've seen in other areas how AI can sometimes perpetuate biases,
Huh.
often with a really negative consequences, and we definitely don't want that happening in healthcare.
No, absolutely not. And the risk is there because if the data that's used to train these AI models is already biased, then the AI is just going to amplify those biases,
Right.
and that could lead to people getting unequal treatment.
Yeah, with potentially harmful outcomes.
Exactly. So, how do we address that? How do we make sure these AI systems are equitable?
Yeah. How do we do that?
Well, it starts with the data. We need to make sure that the data that's used to train these models is representative of everyone.
Diverse data.
Exactly. It's also crucial to have diverse teams of people developing these systems.
Right. So it's not just about the technology itself, it's about the people who are creating it.
Exactly. And it's an ongoing process. We need to monitor these systems and test them and make adjustments as needed.
Yeah.
It's not something you do once and then you're done.
It's a constant evolution. It sounds like there's a lot of work to be done, but it also feels like there's a real opportunity here to use AI to make healthcare more just, more equitable for everyone,
Yeah, I agree. I think there's so much potential for good, but we need to be thoughtful and we need to be careful.
for sure. Now, beyond those issues of data privacy and bias, are there like broader societal implications that we should be thinking about as AI becomes more integrated into healthcare?
Yeah, definitely. One concern is the potential impact on jobs. There are some people who worry that AI might automate a lot of the tasks that are currently done by doctors and nurses and other healthcare professionals.
Yeah, that makes sense. I mean,
Yeah.
we've seen it happen in other industries. It's natural to wonder if healthcare's next.
Right, but I think it's more likely that AI is going to augment human capabilities rather than
Huh.
replacing healthcare workers entirely.
Yeah, that's a good point.
So you can think of it as, AI could handle some of the routine tasks,
Right.
freeing up doctors and nurses to spend more time with patients, focusing on more complex
So
cases.
it's not about replacing human connection, it's actually enhancing it.
Exactly. And then I think another concern is, the potential for us to over-rely on AI.
Oh, yeah.
We have to remember that AI is a tool, and like any tool, it can be used in good ways and bad ways.
Right. We can't just blindly trust AI. We have to use our own critical thinking skills.
Exactly. Ultimately, doctors and patients need to be the ones making those decisions about healthcare, not algorithms.
Well said. So as we wrap up this deep dive into generative AI in healthcare, I'm feeling really optimistic about the future, but I also realize there's a lot to consider.
Yeah.
It's a powerful technology, and it could really change healthcare for the better. But we need to be mindful of those risks and proceed with caution.
I totally agree. It's a really fascinating field that's changing all the time. It's
Hmm.
going to be interesting to see what happens in the next few years.
I think the biggest takeaway for me is that we need to have these conversations about the implications of AI and healthcare, and we need to work together to make sure it's used responsibly.
Couldn't agree more.
Well, we hope this deep dive has given you a better understanding of just how much potential generative AI has in healthcare and also the challenges we need to be aware of.
Absolutely.
As this technology continues to evolve, stay informed and let your voice be heard. The future of healthcare is being shaped right now, and we all have a role to play in it.